Hello and welcome to Yodo. I'm Dr. Sarah Bone, and I want to provide some information today on sleep habits and insomnia. Sleep is the body and brain dropping into a less conscious state so that the body can perform repairs. It's like rebooting and installing updates every night, and it's absolutely necessary. The body has the ability to maintain many basic functions while you're asleep, and other functions are altered or completely suspended during sleep. For many, it can be amazing to think about we sleep 1/3 of our life away. Good sleep indicators include waking at the same time each morning, feeling refreshed and sharper reflexes, feeling cognitively on top of our game, as well as having a good immune system. Sleep is a crucial daily need, and good sleep is very important. Some essential body and brain maintenance occurs while you sleep. Conversion of short to long-term memory. Sleep affects our ability to learn and retain information. Repair hormones are released, immune system updates are made, and sleep provides the opportunity for our heart to rest, blood pressure to decrease, and for injuries to heal. There are many connections between health and sleep. The management of illness, pain, stress, improving our ability for resilience, our ability to bounce back, and optimizing learning, memory, and cognitive function. The ability to slow that process of aging is also tied to our habits of good sleep. So sleep is a key function and it deserves our attention. Today we're going to focus on disrupted sleep. We're not going to go into a lot of detail about medication or the numerous health issues that contribute to sleep, but we'll touch on those a little bit. That being said, a thorough medication review and addressing health issues are key components of good quality sleep and regaining control of our sleep if it's out of whack. If sleep is not fitful, it needs attention. Treating sleep is typically multifaceted, and obtaining a complete sleep history can provide a lot of information to give direction for proper intervention. As with so many other things in healthcare, the interventions and the side effects are all interrelated. We need to understand and learn the sleep habits of the patient. If this is an acute problem and hasn't gone on for very long, then interventions are more likely to be easier and more successful. We want to address what's causing those changes and treat that so that this doesn't become a long-lived problem, because then it becomes progressive and more difficult to treat. There are numerous free phone and watch sleep apps available that can assist with providing information about sleep. It can provide information about the various levels of sleep that are reached and how much time is spent in each one of those phases. It can even provide information about snoring. Your physician, however, may order a full sleep study to provide full detailed evaluation of your sleep habit. Poor sleep, despite adequate opportunity for sleep, if that's gone on for more than 3 nights, for greater than 3 months, that's what insomnia is. Insomnia is a chronic issue, an ongoing issue, and typically can be progressive. As you'll hear, to treat poor sleep, there are a lot of questions that are going to be asked. Insomnia and overall health is a catch-22. Poor health affects your sleep, and poor sleep adversely affects your health. To prepare for your visit to your doctor to talk about your sleep habits, you're going to want to track some information and have some data with you when you go. The steps of sleep disruption include sleep disturbance, circadian rhythm abnormalities, that's what tells your internal clock it's time to get up or time to go to bed. Do you have conditioned arousal? Are there sleep affect changes or sleep worry? What's the sleep hygiene? All of these things, if out of whack, can cause further disruption in your sleep and learning of bad sleep habits. Let's talk a moment about normal sleep. As with the appreciation of beauty being in the eye of the beholder, appreciation of sleep depends on the person sleeping. If poor sleep is complained of, evaluation is needed to get to the bottom of things. Some people are just short sleepers and less sleep is still fitful for them. Others require more sleep to feel fully rested. Thus, the quality of sleep is not simply a function of the time a person is asleep, but also the quality and how the person feels the next day. Did you get a full 40 minutes of sleep last night? Normal sleep patterns vary by age. A younger person has a longer perception of the length of a day. A younger person between the ages of about 5 and 25, they sense that the day is about a 25-hour day. They may need as much as 9 to 15 hours of sleep in that 25 hours though. So you're going to feel like your teenager always wants to stay up till 11 or 12 or 1 o'clock, but then they never want to get up till 8 or 9 or 10. And that's because of their internal clock running on a 25-hour day. From age of about mid-20s till about mid to late 50s or 60s, a person feels like a day lasts about 24 hours, and those individuals typically need 7 to 9 hours of sleep in that 24 hours. For someone past their 60s, though, their internal clock may be on 23 hours, and they may feel like they need 8 to 11 hours of sleep nightly. So they may feel like at 8 or 9 o'clock every night, they're just barely able to hold their eyes open, but by 4 or 5 o'clock in the morning, they're ready to get up and get going. That's that shorter perception of a clock or their internal clock. Obtaining a full sleep history is complicated, but it's very crucial. It's really important. Questions may include learning the history of sleep and the details of sleep. How long is the sleep latency? Is there trouble getting to sleep, trouble staying asleep, or early morning awakening, or a combination of those? How often and under what circumstances does the person not sleep? How do they feel throughout the day? What's the overall health of the individual? Is their health pretty good? Do they have blood pressure or blood sugar issues? And what's their daily function and daily activity? Does the person feel sleep pressure in the evenings? And at what time do they feel like that bedtime ritual needs to begin? What's the daytime activity and what's their regular strength and fatigue? Are those out of whack as well? Other issues that need to be reviewed are pain, mood issues, anxiety, depression. They're going to take a thorough review of any medications, whether it's regular blood pressure medications or heart medications or sugar medications, as well as medications that might be over the counter that could either be causing a person to feel more fatigued or cause a person to have more of a stimulant effect. We're not going to go into a lot about the medications because that's a huge topic itself. But briefly, some medications could enhance or disturb sleep, either directly or an unwanted side effect. Thus, the timing of taking medications can also be a factor. Sometimes medications that affect one family member one way may not have the same effect on a different family member. Sometimes it's a combination of the medications that's causing the disruption in sleep. So we don't want to overlook the amount of impact medications can have on a person's sleep, but we're not going to go into a lot of detail on that today. We can do that in a separate video if there's interest. For many patients, they're likely to have associated symptoms, and it's important to learn about the associated symptoms to try to tease out the order of these occurrences of the sleep disruption. Fatigue, malaise, motivation. Are they generally not just feeling well? Is there daytime sleepiness, poor energy, or poor stamina? What about attention issues or cognitive struggles, memory concerns? Sometimes they'll describe irritability or anger, mood issues, anxiety, or frank depression. Sometimes there's physical symptoms such as headaches or GI symptoms, weight changes, and sometimes snoring can occur either because of the sleep issue or caused the sleep issue. As we learned in a previous video, sometimes people will sleep in a recliner, and this can be an indicator that the patient overall is at a higher risk level. So regarding health or illness and sleep, this is a long list, and I'm just going to touch on a few things here. But some issues are going to result in a person needing more sleep, but that the sleep they receive may not be fitful. Pain is probably the largest category of health issues related to disrupted sleep. Pain, whether it's osteoarthritis, possibly restless leg or vein issues, neuropathy, whether it's heartburn, reflux, and certainly if there's a malignancy, those kinds of causes of pain can all cause disrupted sleep. Heart issues can be a culprit, whether it's hypertension, heart disease, history of a heart attack, a weak heart such as congestive heart failure, but any heart or lung function problem can cause the person not to be able to sleep well. If they can't lie flat, they may be uncomfortable with a couple of pillows behind them and feel like their sleep is disrupted. Certainly hormones and endocrine issues can cause problems with sleep. Thyroid issues, menopause, diabetes are just a few. Diabetics might awaken during the night either because their blood sugar is high or because their blood sugar is low. Sometimes the diabetic has a phone app, and the phone app might be what wakes them during the night because their blood sugar is abnormal. Even bowel and bladder issues can get in on the act of messing with a person's sleep habits. Weight issues, sleep apnea, and primary or secondary lung issues such as asthma or COPD, anything that can cause a person to not breathe well at night can cause them to wake up. Mood issues, nervousness, depression, mental health issues that can prevent someone from being able to go to sleep or possibly wake during the night need to be evaluated. There are many neurologic issues that can disrupt sleep, whether it's seizure disorder, cognitive issues such as dementia, history of stroke, mental health issues, or mood issues. There are also primary sleep issues such as narcolepsy. It is important to realize that not only can these issues cause disrupted sleep, but disrupted sleep can affect them as well. Any of these can worsen already poor sleep habits. Sometimes the sleep is disrupted not by a health issue, but by circumstance, whether that's kids, parents, pets, the neighbors, and certainly employment can cause disrupted sleep. And if that goes on long enough, then that learned sleep habit can become more of a routine. So let's talk a little bit about treating insomnia. You're going to go see your provider, and they're going to gather a bunch of information and review medications. The next step may be to provide a medication, and we could go through those in a separate video because that's also very complex. Not just the meds that can cause sleep disruption, but the medications used to treat sleep disruption is also very complicated. But leave it to say there are many medications that can provide short-term assistance for sleep issues, but they don't duplicate that fulfillment of normal sleep that's natural. The use of medications is not reliable. There's no single one medication that works consistently for everyone that duplicates fitful sleep. Consider some famous stars or musicians that have had sleep problems. We just don't have the chemical ability to duplicate natural sleep. So it's not a straightforward resolution to take a pill to sleep better. As sleep issues worsen and become chronic, it becomes more of a habit. So successful treatment of sleep issues needs to be multifaceted. Evaluation and analysis of all those questions that we went through and provide those interventions. Interventions and changes that need to be evaluated and reevaluated on an ongoing basis depending on the response. Solely offering medications is not likely to be made for a person with a chronic sleep issue because implementing other changes is also necessary. And then, of course, monitoring the changes that occur from the changes and the medications. This is getting complicated really quick. Many patients now are resorting to use of cognitive behavioral therapy interventions, and that is sort of like homework for your sleep process. Cognitive behavioral therapy, or CBT, can over time show significant improvement in sleep hygiene and the overall sleep-wake cycle. CBT is thinking and doing things a new way to create new habits and letting go of old ones that maybe aren't so healthy. We like habits. We're mammals, and we do better if we do things in the same way at the same time. Even though that may sound boring, it's actually healthier for us. CBT to treat insomnia has shown to be very successful. It's to assist a patient with breaking down an issue to look at the individual components so it seems less overwhelming. And it can help patients find a new positive way to deal with many issues. CBT involves changing the way an issue is thought about to alter the perception of the issue. Looking at individual elements of an issue can make it feel less overwhelming and increase its treatment success. It's not easy to let go of beliefs and fears to change the way that an issue is perceived. It can be difficult not to focus on prior bad experiences. Being open-minded and managing perceptions and trying new things is no easy task. Changing the way we think about and approach sleep can alter the sleep-wake cycle and reduce our insomnia and improve our ability to obtain fitful sleep. But it takes time, and a lot of us really struggle with things that take time. So for CBT, they're going to review all that same information we went over, and they're going to talk about waking issues, the occurrence, duration, and frequency. All of those factors are important, and learning the ability of the patient to maintain their sleep. What is the patient's total sleep time? And do we have enough data that we can affect the changes that we want? Making these changes is difficult, and patients are going to be instructed how to make these changes by their CBT specialist, and they have to stick to that new sleep routine for several weeks because they're trying to learn a new habit. We're trying to retrain our mind and our body about relaxation and about sleep. And choosing to sleep in or take a long nap can really undo some of the hard work and the changes that a person has already made. It takes a lot of discipline to get up in the morning when a person has had a lousy night's sleep. And there may seem like there's a lot of those when CBT really begins. Treating insomnia is not for wimps. It's really difficult, and you have to give it your best effort for several weeks to gain control of that sleep cycle. Let's have a brief sidebar about some basics of sleep phases. We're not going to get real technical on these sleep phases, but realize that as we go through the day, we're going to build sleep pressure so that when evening comes, we feel like we're ready to go to sleep, and then we'll be ready for stage 1, which is light sleep. Typically 10 to 20 minutes of sleep at the first part of the sleep cycle. It's usually easy to awaken someone here, and it's a non-REM sleep cycle. Then we will drop into stage 2, which is our core sleep, and the stage where we spend most of our night is this stage 2. It's deeper, and waking someone from stage 2 can leave them feeling pretty groggy. Then they'll drop into the deep sleep or slow wave sleep, and this is where the body restorative processes are occurring. It's usually during the first part of a sleep session, and it can be really difficult to wake somebody during stage 3. And the REM sleep, or the rapid eye movement phase, this phase plays a role in learning and memory. The muscles of the body are very relaxed here, but there are eye movements as the dream sequences occur in the REM sleep. Typically, there are 4 to 6 of these cycles during a night, and each one of these cycles can last 90 minutes. So back to CBT. It has to do with sleep restriction and stimulus control, limiting the person's time in bed and trying to determine the number of hours they actually need for sleep and determining how much time in bed they need to receive fitful sleep. It sounds like it's surprising, but almost like it's going backwards. As sleep improves, the time allowed in bed, typically over weeks, not necessarily days, and certainly not months, but over a few weeks, they're going to allow that person to have more sleep. But the path to improved sleep through CBT can be difficult because you can feel like you're a little bit sleep deprived for a period of time. So retraining a person's body for better sleep takes time because we're relearning new habits. Moving from inability to sleep and learning the feeling of sleep and improving the body's ability to get good sleep takes time. It's crazy to consider that we need to learn how to sleep. When a person has had insomnia, and that's a prolonged period of time they've learned how to sleep poorly, it takes a while to relearn good sleep habits, to retrain their body and retrain their brain. It's necessary to manage stimulus control, and our mind may have to relearn what bed is for. Bed is for sleep or bed is for sex, but bed is not for a place to read or snack, scroll the internet, or watch a lot of TV into the wee hours of the morning. Retraining our brain and our body takes time, discipline, and it takes the support of our family and our bed partner. As monotherapy, neither CBT nor medication works as well as the combination together. Good sleep hygiene involves many things during the day as well as the evening and at night. We want to give our body good daylight during the waking hours and dim light in the evening hours. We want to limit or avoid stimulants such as nicotine, caffeine, or stimulating activities that we might participate in 2 to 6 hours before bed. Sometimes watching a scary movie at bedtime is not the best thing to do. We want to avoid heavy or large meals in the few hours before bedtime, and we want to be mindful of the medications that we take at bedtime. We want to allow ourselves time to wind down and learn how to relax. We may need a place to record our thoughts, especially if it's thoughts that are waking us during the night that are preventing us from winding down. Bedtime routine needs to be consistent, maybe a hot bath or lighting some candles, but something to help us wind down and relax in the evening. Sleeping in a cool, dark room, and certainly limiting of electronics or blue light. If you've got a standby light on your television or on your your VCR, you may want to put something like a dot or a piece of paper over that. Some people do well with white noise. There are several white noise apps that you can either put on your phone or you can get a white noise machine for your bedroom. The best practice is for proactive good sleep habits. Don't let bad habits go on for a long period of time without intervention. Have regular health checks and stay on track to manage chronic illness. Stay active earlier in the day and then be proactive with relaxation and prioritize your mental health. Enjoy good sleep lifestyle and respect your proper circadian rhythm. Help your body know it's night and not challenge it with a lot of bedtime activities or a large bedtime meal or some sort of stimulant that may keep you up at night. So in summary, getting fitful sleep affects your health, and your health affects your ability to get fitful sleep. Help yourself have positive sleep habits. Resist the urge to sleep in or go to bed significantly early or significantly late, and try not to take long naps that might interfere with your circadian rhythm. When it's time to get up, even if you didn't sleep all that well, maybe you should get up and get going. It might surprise you how well you sleep the very next night. Treating sleep is complicated, and if your sleep is disrupted, you should be seeing your healthcare team and bring it to their attention. Thanks for being here today. I hope I provided some helpful information. If you've got a specific question or comment, please drop it below. Check out our other videos, and if you've got a specific topic you want to learn about, please let us know. Thanks. Bye now.